Script Your Future is a national public awareness campaign on medication adherence. This campaign focuses on helping individuals with chronic conditions take control of their health by equipping them with the education, tools, and encouragement they need to help them take their medications on a daily basis. The campaign is designed to unite multiple healthcare professions in the task of promoting medication adherence. The University of Mississippi School of Pharmacy has accepted the challenge and is taking steps to provide the Jackson and Oxford, Mississippi communities with the information they need to improve their health outcomes by taking their prescription medications correctly. We started this project by asking professional students, what percentage of patients do you think do not take their medications as directed? What percentage of patients do you think don't take their medications as directed?
Throwing a number out there, I would just guess around 80%.
I would maybe say like 60%.
50%.
It's actually 75%, so it's a pretty good guess.
Wow, okay.
And 1 out of 3 never even pick up some of the prescriptions that they get prescribed.
Wow.
I can't believe that.
Let's take a look at some of the reasons that people do not take their medications correctly.
I can't afford to take this medication. The refill, every time I get it each month, it's $47, and I just can't afford that right now.
Both prescription and non-prescription medications can be very expensive. It's common for patients to feel that they cannot afford to pick up their medication, or they may try to make their medications last longer by not taking them as many times a day as prescribed. If these are reasons that you're not taking your medications as prescribed, let us give you a few tips.
Tip number 1, if your medication's too expensive, check with your doctor and make sure if there's a generic available. That might be a cheaper option, but sometimes even the generic can be expensive.
Another tip, if you don't have a generic medication, you can go to the medication's website and type in the drug name, whatever your brand name is, .com, and see if they have any discount cards available that you can print out and take with you to your pharmacy. There are also websites and apps available that you can use to make your medication more affordable. One example is GoodRx. This website can be used to look at the prices of medications near you and also to find if there are any coupons that can help bring the price down for you a little bit.
Tip number 4, if you can't afford your medications, there may be other medications that your doctor can prescribe in the same family that will be affordable for you.
As you can see, there are many avenues that you can take if you feel that you cannot afford to take your prescription. Take a moment to talk to your doctor or pharmacist about all of your options before deciding to forego taking a medication altogether.
I'm just having a lot of trouble remembering to take all this medicine. I mean, when I'm taking it 4 times a day, it's really hard to remember to take it that many times.
Whether you take 1 pill a day or 30 pills a day, it can be hard to keep up with. Some are taken in the morning, some are taken in the evening, some are taken with meals, and some are taken without. It is incredibly difficult for anyone to keep up with, in addition to all of the other things we have going on in our daily lives. If this is a reason that you don't take your medication as prescribed, let us give you a few tips. Tip number 1, set an alarm. This can be done on your phone, on your Fitbit, on your watch, on your tablet, or just wherever you can set a timer or alarm. Depending on your alarm, you may even be able to program it to indicate how you're supposed to take your medication. For example, you can set an alarm to go off at 7:50 every morning as you walk into work. Make sure it says to take your blood pressure pill with water. If you normally take your medication at a time of day when you can't be sure if you're going to be in a meeting, set the alarm for vibrate for the least disturbance. Tip number 2, place your medications somewhere you will see them and remember to take them. If you take your pills every morning before breakfast, place them near your coffee pot or your fruit basket. If you take them every night at bedtime, place them on your nightstand. If you keep forgetting to take a medication because it goes in the refrigerator, place it in front of an item that you use in there every day. Put it by the mustard so that every morning when you reach in there to make your sandwich for lunch, you reach your medication first. Tip number 4, leave yourself a note. You can put a reminder on your bathroom mirror, on your door, or in your car to remind you to take your medications before you leave the house in the morning. Tip number 5, use a weekly pill sorter. This provides you with not only a location to put your pills for the mornings and evenings, but it also provides you with accountability. If you're not sure whether or not you took your morning meds, check your pill sorter. If they're still there, you must have forgotten. If forgetting to take your medication is common for you, use any one of these tips to help you remember to take them each day.
I'm really afraid to take this one. I mean, I've seen lots of commercials about the side effects of this medication.
There are side effects to all medications, and some of those can be pretty scary. If side effects are a reason that you're not taking your medication as prescribed, let us give you a few tips. Many of the side effects that you read about on the internet are rare. These side effects must be reported in the package insert of the medication that you are prescribed. If you're worried about side effects and how a certain medication may affect you, ask your pharmacist or physician. They will be able to give you professional healthcare advice on specific questions that you have about your medications. If you do experience side effects, it is important to monitor when these side effects occur and with what medication. This will give the pharmacist or physician more information to determine which medication is causing the problem. They may also have an alternative medication recommendation with fewer side effects. If you're afraid to take your medications, talk to a pharmacist or physician about any of your concerns. They would love to address those with you.
I quit taking this one about 2 weeks ago because I felt the same whether I took it or not, so I didn't really see the point in it.
Some disease states that require medications may not have any symptoms at all. For example, you may not feel like you have high blood pressure, but if you leave high blood pressure untreated for a long period of time, you put yourself at risk of heart attack, heart disease, heart failure, and stroke. It is important to learn why you're taking each medication and how each medication that you're taking will help your specific disease states. If you're not taking your medications as prescribed because you do not feel that you need them, let us give you a few tips. It is important to learn about your disease state and how the medications that you're taking may help better your quality of life. Your pharmacist or physician is a great resource for educational information about your disease states and medications. If you want more information about why you take your medications and how they can help you, ask your pharmacist, physician, or go to www.scriptyourfuture.org. In summary, let's hear from a variety of health professionals about the importance of medication adherence.
Why do you think medication adherence is important?
I think it's important because if you don't take your medications, then you're not going to get any better, and you can't control things such as diabetes and blood pressure.
So why do you think medication adherence is important?
So I think for the patient, medication adherence is important because sometimes as a patient you don't really feel sick for what you're taking medicines for, but it's still important to take it every single day instead of just when you feel sick. For the doctors or medical students taking care of the patient, I think it's important for us to kind of help decipher if the medication isn't working because the patient just isn't taking it like they should every day, or if it's not working because it's not an effective medicine, it's not treating the problem, it's something that we need to change.
Well, medication adherence is essential for safe and effective dental treatment. It is imperative that physicians, pharmacists, dentists, and all members of a patient's healthcare team work together and stress the importance of medication adherence. Whether it is antibiotic, high blood pressure, or diabetic medication, each has its role in a healthy mouth and eventual successful dental treatment.
Medication adherence is important because if you don't take your medications, how can they work? The idea behind taking your medication as prescribed is that we're able to control your disease state so that you actually have a future. By taking your medication, you'll not only be able to control whatever your medical condition is, but you'll also reduce your cost in the long run by preventing yourself from having to take more medications to control a more advanced disease state.
125,000 people die every year due to medication non-adherence. Medication adherence is important. For more information about medication adherence and free tools to manage all your medications, go to www.scriptyourfuture.org.